So I'm Michael Hofer. I'm pediatric rheumatologist and immunologist in the French part of Switzerland, and I'm the chair of the JIR network.
Yeah, my name is Dirk Foell. I'm pediatric rheumatologist from Münster, Germany, and I am currently the chair of the EULA Pediatric Committee.
And this is the reason why we have this conversation. I would be very interested to know how we can have the best relationship with our colleagues from adult rheumatology. Pediatric rheumatology exists now since 25 years, more than 25 years. So we are adult now. And so now we can speak with our adult friends. And how do you see the situation?
First of all, nice that you mentioned that we have this history actually where we came from and where we are now. And to be honest, in adult rheumatology, there's a good energy. So there's a good attitude, and they realize that pediatric rheumatology has really improved a lot and became much more professional over the past 20-25 years or so. A part of it is certainly due to activities like the JIR Academy and the JIR cohort and initiatives, also other initiatives, of course. So pediatric rheumatology was very active in getting more evidence on what they do, getting more professional, not only on an organizational level, but also in terms of getting, let's say, more data on how we treat patients and how we are. So I think there's a lot of respect, first of all, both ways, of course, both sides. And to improve that is, of course, always to be active with each other, so to say. So to find common projects and initiatives, and also maybe challenges. One challenge certainly is transition. Transition means where a patient is treated in childhood, so the disease starts in childhood. In former years, we often thought we stop it also in childhood because we are so good with treating. Actually, we get better with treating even. But at the same time, those we then transfer into adulthood are those with very complex diseases which we managed somehow in childhood, but they need to still continue with receiving care in adulthood. And this is this process of transition where we have patients then transferred to adult rheumatology, which changes concepts and is of course very important for the adult rheumatologist to understand how pediatric rheumatologists and why they were treating the patients in the way we did it. And on the other hand, it's very important for us to emphasize how important it is that our patients, when they get older, are treated again and continued with the best possible care by the adult rheumatologist. So this is, I think, the most important challenge on the one hand, and also action point and point where we can achieve a lot together.
Because it's really the bridge between our care and the care of the adults, and it's very important because young adults are very fragile in this period for their disease and for the compliance. So it's a very important project that we can have in common. Now, can you tell us on more projects? For example, I remember that you participated to an initiative on Still's disease. And this is interesting because finally we were in advance for this disease, and now we can work with our adult colleagues on this disease.
Yeah, that's true. I think when we started, now again talking about history maybe, so you started with that, we grew up and now we are adults. When we started as a child, our main interest as pediatric rheumatologists, and I think I'm not speaking so much for myself, but for those who invented, so to say, who set the scene at that time, one key interest was to get independent from adult rheumatologists and to emphasize that, yeah, children get rheumatic diseases, inflammatory diseases too, and they are different from adult rheumatic diseases. That's why a specialty like pediatric rheumatology, a special care for those patients within pediatrics is important. So we always emphasized the differences between the childhood disease forms of a rheumatic disease that also exist in adulthood. In many instances, not only in Still's disease, a project that I got involved in recently of the Pediatric Rheumatology European Society and EULA, the Adult Rheumatology Society in Europe, but also in other diseases, juvenile arthritis, lupus, and so on. So there was this separation for a reason, because we wanted to make clear that in kids there is a need for special care and special experts also. And now I think we get to that point where we realize that we gain more when we combine and learn from each other, and especially also as pediatric rheumatologists learn from the adult colleagues. And now one of this example is the new classification and the new recommendations on how we treat patients with a disease called Still's disease, that was formerly called Still's disease, then only in the adult still called Still's disease, the adult onset form of Still's disease, and the pediatric rheumatologist got rid of that term and called it systemic juvenile idiopathic arthritis. And that sounded as if these were two different diseases, but it is rather a continuum over time. Presentation can be different in children than adults, clear. Also care can differ, but it is still a continuum. And now we came together in such an initiative, and it's an example of one of also other initiatives where pediatric and adult rheumatologists joined together and agreed upon a new view on this disease, and also on recommendations that would then overspan different age groups.
This is interesting because you are telling that first we had to establish pediatric rheumatology and show that we have a lot of specificities which are important for our patient. And now that we have shown that, we can collaborate to see where bridges are with the adults. Another subject where we also build bridges is for education. For example, Congress, or also for the online course. Could you tell us a little bit more about this project?
Yeah, that's true. Congresses are at the moment more separated again when it comes to EULA and press conferences, but that is more organizational matters. The JIR Winter School is an example, really a very good example where one can meet again, adult and pediatric rheumatologists. And these educational activities is extremely important because that is one of the main also interests of EULA, so the Society for Adult Rheumatologists, to improve education all over Europe. And this is something they opened also for pediatric rheumatology. So there's an online course of pediatric rheumatology. I think it's the 12th edition that is now under revision, so to say, because it always needs constant improvement and renewal. So something that is offered via that platform. There will be a course on autoinflammation, and that is under development exactly now as we speak, so to say, and will be another very good opportunity to team up with adult rheumatologists. It was brought up by pediatric rheumatologists. So that was the idea, but EULA said, please involve adult rheumatologists, and this happens now, and it is a very good example of something one can do together.
It's again a group of disease where we have this continuity from child until adulthood, but where the most of the diagnosis is done at the pediatric age, because these are mainly genetic disease. But it's important that we continue, because if you have this stop in interest, then it's not good for our patients.
Absolutely.
Finally, the last topic, which is also very important, because there we need the help of our adult physician, is research.
So in research in EULA, there are actually, so the research committee, let me start with that, so organizational matter again, within EULA has pillars. And there's a pillar on basic research. Basic research is more on cells than on patients, so cells differ not that much. And I think in pediatric rheumatology we have really strong basic research. And then there's epidemiology. And in epidemiology, if you want to have a view on how people are affected in Europe by rheumatic diseases, what is the best treatment and so on, outcomes, then you can't do without data from children, actually. You need that. Otherwise, we need the data from the adult rheumatologist, because long-term outcomes we are very interested in. What happens with the children after the age of 18? We lose them then, and it's very interesting to get the information for us also. How are they at the age of 35 or 50?
And to learn what we did maybe wrong and
Yeah,
what we can
exactly.
do better when
Exactly.
we see what they have as problems at 30, for example.
We are blind for that, so
Yes,
to
yeah.
say. So we need that long-term data, which we can only get from adult rheumatologists, but they need to know the data from the pediatric rheumatology and the children, because otherwise they would be blind for all those people affected very early in life, which of course changes their lifetime history with that disease dramatically. And that's the epidemiology pillar. And there's a strong combination. They have strong, very good initiatives. One is called Rumor Facts, where we contribute to now. They collect data on facts on rheumatic diseases, which is important for research, but in the long run also for advocacy, because you can only talk to the, let's say, politicians at the European level about diseases if you have data on it, how much people are really affected. And then there's clinical things, of course. So actually, the pediatric side has had a network called Printo, an organization fostering trials on pediatric disease that is as old as you said, or maybe 25 years or so. I don't remember the exact year when it was founded, I have to be honest, but around that. And EULA just started something like that, ENTRI, so a European network of trials initiatives, more recently in that research committee. And they are very interested in learning from the pediatricians, actually, how they were setting up such a thing. And again, this is a very good, even if Printo may be transferred into other initiatives in the future, this is another example where research networks, they're not clinical research in that case, can really benefit from each other.
And this is very interesting because when I started pediatric rheumatology, our relationship to adult rheumatology was to learn from them. And now we see that we can learn from each other. We can collaborate for our patient because the same patient are going from pediatrics to adult. And I'm sure that in the future, this collaboration will increase and we will all see mutual interest in this collaboration. So thank you very much
You're
Dirk,
very
for
welcome.
this interesting discussion.
It's a pleasure. Thank you.